Sounds Sounds good. Thanks, Lucas. Hi, everyone. Renee Koplewski here from the Share Network. We're excited to be back again and to be sharing a wonderful presentation done by Stephanie Groth. Hopefully I said that right, Stephanie. Stephanie has obtained her Doctor of Physical Therapy at St. Louis University, and she completed all of her residency training at University of Chicago Medicine and became a board certified specialist. She's worked at the main campus here at University of Chicago Medicine, as well as the South Shore Senior Center, providing outpatient physical therapy for adults and seniors with a wide variety of conditions. Today, she comes to you to discuss the importance of maintaining mobility as we age and the relation of exercise and maintaining mobility and lowering our risk for falls. So hopefully you have your questions ready. And without further ado, I'm going to hand it on over to Stephanie.
Hi, everyone. It's so great to be here with you guys today. I put together a presentation of slides that, like we were talking about, kind of talks a little bit about balance, a little bit about strength training, a little bit about how you can participate and engage in more activity and what benefits that can have for you. I have a few slides that kind of have some questions to the group. I would love to hear your guys' input on them and hear your reflections on what has been working well for you or not so well, or challenges, and kind of make it a dynamic conversation. So with that being said, I think everybody is muted at present. So when it comes to those red slides with a question, I'll just ask that you unmute and engage in the conversation. So let me go ahead and share my screen. I think it's this one. Perfect. Okay. So I will be having my little chat icon minimized, so I won't be able to see if folks have questions. So if I could ask that if you need to like raise your hand if you have a question besides like those slides.
I'll keep an eye on it for you, Stephanie. So no, you're good to go.
Okay, so overall today we'll talk a little bit about balance and falls. We'll talk about tools, repairs, modifications to help with that. And then we'll spend a good chunk of our time talking about kind of an overall introduction to exercise, exercise prescription, and barriers to exercise. So starting out with balance and falls, what actually is balance? Balance is the ability to maintain your center of gravity within your base of support with minimal postural sway. So the three main phrases that we're looking at is your center of gravity. That's just kind of where your weight is. Your base of support is where your body is. It's kind of like the shadow of where your body is. And then postural sway is like how much control do you have? So we'll kind of break down some of those definitions a little bit more as we go along. Overall, how does balance change as we age? There are different conditions that can impact our balance. So for example, neuropathy. Neuropathy is when you get numbness and tingling. It's most often in our feet or our hands, and that can impact how we feel the ground beneath us. So naturally, if you can't feel the ground as well, it's going to be harder to know where your center is. Pain or stiffness in our joints or muscles can definitely change how we move and how we engage with our environment. Medications can impact our balance if they cause dizziness or blood pressure variations. As we age, our reaction time is slower. So one of the things that we talked about with balance is how we're able to minimize postural sway. So for example, if we have a balance challenge that causes us to wobble, as we age, that wobble happens a little slower, which means our weight might go outside of our center of gravity faster and make us more at risk of falls. And then lastly, muscle loss can make it harder for us to maintain our balance. Specifically, the muscles in our core or around our abdomen and our hips are really important for us to maintain control. So this was a visual that looks at what our base of support is. So the base of support is the area beneath an object or person that includes every point of contact that that object or person makes with the supporting surface. So image A, if I'm standing on one foot, my base of support is rather small. Image B is where you're standing normally, just feet separated, hip width apart. You can see it's doubled in size or tripled in size. And then image C is if you were to imagine that you're standing normally and you have this cane here, this cane tip here, crutch tip here, that makes your base of support even larger. So you can imagine kind of like the stability of a stick standing up on the ground versus the stability of a pyramid. The larger your base of support is, the easier it is to maintain your balance. And that's the concept in part behind why we use assistive devices like canes or walkers, is it's to make our base of support larger. Here in this picture, this is kind of breaking down this concept of what balance is. So this dotted line that you see in the first picture is describing the center of gravity. Again, center of gravity is where most of our weight is. Between his legs, that's where the base of support is. In this first picture, you can see he's centered over his feet, over his center of gravity, so he's got good balance. As you progress to the later on photos, as his weight shifts forward past his feet, his center of gravity shifts outside of his base of support. So that's what makes him feel like he's going to fall. So this is what happens, for example, if we've all been there, we reach for something and we didn't realize how far it was, and then we step forward. It's because our body weight went too far past where our feet is. And that can be one of the challenges with balance, is that kind of dynamic. Does anybody have any questions about like kind of what balance is or how to interpret this image at all? Okay. So in terms of, let's say we encounter a balance challenge, then what's going to happen in our body? Depending on what you're looking at or your perspective, you'll see different variations of this list. I made it a little bit more comprehensive to break it down, but essentially, in an ideal setting, an initial balance challenge is going to create some reactions at our foot and our ankle. So our foot and ankle have about 28 bones in it and an even larger number of muscles. What these muscles and bones are doing is they're wobbling back and forth, they're tipping forward and back. You can feel that like little wobbliness in your foot and your ankle. That is a good and normal balance strategy to have in your feet and your ankle. If that foot and ankle can't respond enough to the balance challenge, that's when our hips and our knees get involved. So you might feel your hip dropping or your knee twisting. You're kind of getting a little wobble. From there up the chain, you might feel your trunk lean. And then lastly, the two biggest balance strategies is going to be our arms moving in the air to try to help catch us, or our whole body actually trying to take a step. So ideally, we would progress if we have a balance challenge from modifying our center of gravity with our foot and ankle, then our hip knee, then our trunk. Ideally, that catches our balance, but if not, we either move our arms, hold on to something, or we take a step. So this is one of those slides for like kind of some more conversation. So feel free to unmute yourself if you would like to kind of chime in. But what are some things that you notice about your body when your balance feels challenged? Do you feel something in your muscles, in your joints? Do you feel pain? Do you feel strength? Or what emotions do you feel when your balance has been challenged? Is anybody up for sharing an experience they had, or maybe something they observed in someone else? Okay. Well, one thing, for example, that I'll notice, like when I'm I enjoyed like taking dance classes. And when I'm practicing some of like the techniques, I feel like my feet are trying to cramp up. Like I feel like all of those like little foot muscles are working really hard, or I'll feel like my hip getting really sore. I'll feel like the kind of things like that. So just some mindfulness things to keep in mind when we're thinking about where our balance strategies are. It's good and normal to feel your legs working hard when your balance is challenged. And it's a normal human experience to feel some emotions when your balance is challenged. So that could be fear, that could be frustration. Those are all really normal things to experience. So if we're bringing it forward to the clinical, how do we assess balance? In the clinical setting, we usually start with assessing static balance. Static balance refers to your balance when you're not moving. So we usually start with looking at different bases of support. So the base of support, if you recall, is kind of that shadow of where your body is. So we start out with a normal base of support. Then we might bring our feet together for a smaller base of support. We might put one foot in front of the other, or we might be on one foot on its own. And then from there, if regular, flat, solid ground is not challenging, we might put you on a different kind of a surface to see how your balance responds to something that's more challenging. So for example, in this picture, there's a foam balance mat. This is going to make you feel like you're kind of wobbly. It's kind of squishy and soft, like a thick yoga mat. So this is going to require more balance reactions. When we're having you progress to these different positions, we're going to be looking at your balance reactions. So sometimes as we age, because of pain, because of neuropathy, because of disuse, you might not have the same balance reactions that we would expect. A lot of times as we age, people don't have those same foot and ankle reactions. And instead of seeing a nice little wobble, nice little muscle contractions in the foot and ankle, what we see is somebody instead falling forward and reaching for the table instead of using their muscles in their foot, ankle, legs, hip, core to keep their balance. If you're able to maintain the position, we might count how long you can hold the position for. And then if you lose your balance, we might say like, okay, how did you catch it? Did you need some assistance from us? Or did you catch it on your own with a table? If you needed assistance, did you need a little bit, kind of a lot, or a lot? Those are some things that we're observing when we're assessing balance. Then going on, we might do a more dynamic balance assessment. So one of the most common ones I do in clinic is called the functional gait assessment. This is a well-established and well-researched test. It has 10 different test items total, and it's scored 0 to 4 for each test item. So it's a total of up to 30 points. Research shows that scoring 22 points or less indicates that you're at risk of falls. The way that we are scoring it, each item has specific measures. So if your gait speed slows down, if you're veering a certain amount, if you have a certain degree of a loss of balance, if you use a cane, these are all things that we're going to be assessing with every single test item to determine what your dynamic balance is like. So these are the 10 test items for the functional gait assessment. These are things that people need to be able to do to be safe and active in the community. So for example, gait speed is correlated with fall risk or safety in the community. So we do a calculation of how much time for how much distance. We look at how you can change your gait speed. So walking normal, walking fast, walking slow. And can you change your speed without losing your balance? So for example, if you're walking on the sidewalk and then all of a sudden a dog runs in front of you, are you going to be able to stop quickly or slow down quickly without losing your balance? That's an important task. Next up, there are horizontal head turns. Can you walk while you look somewhere else? So for example, if you're worried about if the car is going to stop or not, can you keep walking while you keep an eye out for that car? Or if you hear a sound overhead, can you look up while you keep walking without losing your balance? A pivot turn, stepping over an obstacle. Can you walk with a narrow base of support? That one is the one where you're walking in tandem. So one foot directly in front of the other. We assess walking with eyes closed. So if this is looking at if there is any kind of any kind of like issue with lighting. So for example, if you're walking at nighttime, if the light goes out, can you walk with your eye without that visual feedback, without losing your balance, without veering, without falling, walking backwards? And then lastly, it's going up and down the stairs. So those are the 10 items in the functional gait assessment. So what we would do in therapy is we would assess this test at the beginning of therapy, and then we would practice the components of the test that were most challenging, and then we would reassess it once you're graduating from therapy to kind of see what you've progressed in. So moving on to the next section, this is going to be kind of more so about what systems are in place to help with our balance and our safety. So these are, what can I do to prevent falls? These are things that you can do for yourself. So proper footwear. This is a big thing when it comes to falls at home or at special events. Having footwear that is comfortable and secure is very important. So for example, house shoes that are sliding off your feet while you're walking are not going to be so safe, especially if you have changes in flooring. Making your environment visible to you. So if you need to get your glasses prescription updated, or if you need to refresh some light bulbs or things like that, that's going to be really important for preventing falls. Monitoring your diet. I often see people come in where they had some balance difficulties when they were dehydrated, or when their blood pressure was low from not having enough salt, or when their blood sugar was low because they ran out of the house without breakfast and they took their insulin and then they felt very faint. So thinking about your diet and what nutrition you're taking in is going to be really key for preventing falls. Medications is another big one. So making sure that you're communicating with your doctor about what amount of medication you should take at what time and how your body responds to that is very important. The next bullet point I think is really interesting. There's actually a very direct risk between falls and experiencing clinical depression or clinical anxiety. So this is something that I don't have an ability to fully explain. It's not my expertise. But if you do experience significant depression or anxiety, participating in counseling or support groups would be a really great way to work on a component of risk of falls. And then lastly, for preventing falls, participate in physical therapy or exercise. So physical therapy, community exercise, home-based exercise, these are all tools that can help you to rebuild your strength and practice those balance and mobility tasks and skills that are so key in your safety when you're at home and when you're out and about. In terms of tools for balance, assistive devices are designed to help you to walk better. Assistive devices can help you to walk better if you're having difficulty because of pain, or they can help you to walk better in terms of your balance. So again, they make that base of support larger to give you a little bit more stability. On this slide, I have kind of an overview of the different types of assistive devices. So canes, there are straight canes or quad canes. Straight canes come together at 1 point, quad canes end in 4 points. So canes are useful because they're very low profile, they're easy to transport, but in the same way, they're easy to forget. And then they can be challenging to learn how to use. We've all seen folks that have a cane that they kind of carry in the air and they don't swing their arms. Our arms are meant to swing as we walk. That helps us with our momentum and with our balance. And it can be awkward to figure out how to let your arms swing with your cane and still use your cane for support. You can use 2 canes simultaneously, kind of like hiking sticks, to get a little bit more support. One caveat I have about canes is the quad cane. So we know that a larger base of support gives us more balance control. So you might think that a quad cane is going to be your best choice because it's bigger, so it's more supportive, right? The only thing that is, my only problem with a quad cane is that in order for it to actually give you that support, those 4 points have to hit the ground at the same time. It's not going to be supportive if you're rocking through it. So what that means is for the quad cane to be the right device for you, you have to have a really short step length because you have to put that cane down right below where you are. You can't walk and swing it as you go. So before you purchase a quad cane, definitely work with a therapist to make sure if that's the right device for you or not. The next little section here is about walkers. So walkers are going to give you more support. The only downside to them is that oftentimes people have kind of poor posture when they're walking with them. They push it in front of them rather than push it beneath them. You should be pushing down underneath you, not leaning over to push it. The other downsides about walkers is that they're more difficult to transport. And then rollator walkers specifically, those ones with the seat on them, these break down quite quickly. I was speaking with some engineers and they were telling me that one of the components of the brakes naturally breaks down within about 2 to 3 years. And as we know, Medicare only provides you with a new device every 5 years. So that's the downside of a rollator walker. All in all, the thing to know is that there's pros and cons to every assistive device, depending on you and your environment. It's important to work with a professional to determine what is the best tool for you and when. A lot of the patients I see have one tool for when they're at home and one tool for when they're out and about. One tool for a good day, one tool for a bad day. It's not one size fits all. So how can I set up my home to lower my risk of falls? You can remove throw rugs or make sure that they're tacked down really well. Try to keep the floor clear of clutter. Wipe up any spills immediately. Oops, sorry. You can put night lights in hallways or bathrooms, and then look at home repairs or modifications if there are broken steps or cracks in the flooring, anything like that. So another kind of question for the group, what is something that you've done for your body or for your home that has had a positive impact on your mobility and balance? Has anybody tried any new exercise programs or tried a new device that you've really liked? Or what is something that you guys have done so far? What's worked well? Anyone want to unmute and share?
Well, I can say that we have avoided getting hardwood floors because that would mean we'd probably put some rugs down. And we know that rugs are difficult. So I take great care in trying to keep like a rug. We do have rugs in the bathroom, but I try to make sure they lie flat and they're not a tripping hazard.
Yeah, that's awesome. That's a very intentional decision. Okay, so going on to the next section, this is the section where we're going to be talking about exercise fundamentals. So this is getting a little bit more into the nitty-gritty of falls are scary, balance is important, and exercise is a great way to help prevent that from happening. So what will exercise do for me in the short term? In the short term, exercise can improve your flexibility. It can improve your digestion of food, improve your blood sugar control, increase your appetite so you feel more like eating, and it can improve your sleep quality. These are all things that you can experience the same day, within hours, within minutes of when you exercise. In the long term, exercise can help prevent bone and muscle loss. It can lower your risk of dementia. It can improve your ability to do daily tasks, and it can lower your risk of having a fall. So a ton of benefits. In terms of overall types of exercise, how do we break down what we're doing? There's endurance training, strength training, aerobic training, mobility, power, balance, coordination. There's a lot of different ways to break down the different types of movements, classes, interventions that you do. So how do we even begin? There's so much out there. How do we know what to do? What is best for us? at the end of the day, it's really healthy to have a program where you get a mix of the different types of exercise. So aerobic exercise is going to be good for your heart health. Strength and endurance training is going to be good for your bone and your muscle health. And coordination and balance training is going to be good at reducing your risk of falling and feeling more confident when you're out and about. It's important to remember that having an active lifestyle is different than exercise. So especially since the pandemic, I've been hearing a lot of folks report, well, I make sure that I walk to my mailbox every day, so that's my exercise for the day. It's like, well, how long was your walk? How high did your heart rate get? For how long? It's good to be active. It's good to have those routines that help get you moving. Just remember that having an active lifestyle is different than exercise. In terms of the formula for exercise, this is a formula kind of thing. If we're thinking about really trying to make our body change and make it stronger, there is a formula. So the formula to get the most benefit out of aerobic exercise is that you are working at a moderate intensity for 150 to 300 minutes a week. That divides out to 30 minutes, 5 times a week, more or less. I'm not going to talk too much about vigorous aerobic activity because that's something that's important to discuss with your own provider, your own care team. But examples of moderate aerobic activity could be brisk walking, cycling, light jogging, swimming, dancing. This is the scale that we use to determine how hard you're working. So most folks, it is safe to work in this light to moderate activity. You should feel like you're breathing heavy, but you could still carry a conversation while you do that exercise. If you could keep going for hours, if you don't feel any shortness of breath, if you don't even feel like you're exercising, that's more in that active lifestyle world, not so much the exercise world. Next category is strength training. So what is the formula to build muscle? The formula to build muscle is doing an exercise for 8 to 15 reps, 3 sets, 3 to 4 days a week. At the end of your exercise session, your muscles should feel fatigued, but you should still be able to have good form as you do the exercise. Some examples of ways you can do strength training is working with free weights, working with exercise bands, working with gym machines, or doing body weight type exercises. In general, when you're strength training, it is good and normal to feel burning in your muscles and feel pulling and tightness, but you should not feel pain. So that if you're experiencing pain, that would be a good time to visit a physical therapist or a trainer and see what you can do about that exercise or that muscle so that you can exercise without pain. Last couple of categories is flexibility. So not everybody needs to spend much time stretching. Some people naturally hold a lot of flexibility, but oftentimes as we age, because of how our tendons, our muscles change, because of how our activity changes, we tend to get more tight and more stiff. So to build flexibility, stretch what needs to be stretched. So for example, if you feel tight when you reach overhead, maybe it's time to work on stretching your shoulders. If you feel tight or pain when you bend over to put on your shoes, maybe you need to stretch some things in your back or in your hips. That's going to be very person specific, but that's the formula to build more flexibility. 30-second hold, 3 sets, more or less. Then lastly is the balance and coordination section. So when it comes to developing more balance and coordination, practice makes perfect. So the more you do it, the better you'll get. A lot of balance and coordination exercises are integrated into the endurance category of exercise. So for example, the endurance exercises that we talked about was doing things like walking, dancing, martial arts. If you're doing those exercise classes, you're getting your balance and coordination training through that process. And you guys will get this PowerPoint, so you can see those formulas even after we're done today. But in terms of some common challenges to exercise, the thing that I hear the most often is location. It can be really hard to find a routine that works for you, especially if your transportation situation has changed or is frustrating or unreliable. But there's a lot of options in Chicago. There's a lot of online options. You could do online exercise classes that are live. You could do online exercises that are pre-recorded, gyms, senior centers, studios. The most important thing is to know that there is no one best option for everyone. Whatever you can actually do is what's best for you. So just try to get out there or get out of the chair and just do something to help your body stay strong. The next thing that I hear a lot about is pain limiting exercise. So as we're aging, it is common to have more pain in your joints, in your muscles, in your tendons. So what I usually try to challenge people to do is think about the course of their day. If you wake up feeling really stiff, maybe that's not the time to exercise. Maybe you need to wait until you're feeling a little bit more warmed up or loosened up. Or maybe exercising early in the day helps you to loosen up. At the end of the day, if you're having pain, you can always work with a therapist or a trainer to see what is going to work best for you. And then lastly is the knowledge. There is a big learning curve when it comes to safe and effective exercise. So I would encourage anybody to work with a professional, whether that's a therapist, a personal trainer, an exercise physiologist, exercise instructor. I want you to feel like you have control over your days, over your movements, and you feel empowered to get moving. So I would love to hear from the group, like how have you tried to conquer your challenges to being more active or exercise? What has worked well for you? What's not worked well for you? I would love to hear somebody share their experiences.
Well, I want to advocate the Park District does a good job of giving exercise classes. And so a number of us in the village have participated in person. It was at Nichols Park. Now it's online. And of course, they're off for the summer, which isn't so good. But they do chair exercises for older people. And what I like about it is that it tends to get all of your muscles moving without stressing any out. So during the year, twice a week at least, I do an hour with Sonia online. During the summer, not so good.
So this is Susan Alito. I think it's important often to join a group.
Yeah.
You have a commitment and obligation to get together regularly with that group. And it serves two purposes, both exercise and socializing.
Right.
Well, this is Mary Snyder. This is Mary Snyder.
Mm-hmm.
Yeah.
And what I'm saying is I have a dog, and exercise, walking with your dog can be a challenge to your balance, but it's very good for exercises because you move a lot, not necessarily in the proper ways, but in my case, I've been using, I believe you call it a rollinator, simply because that way the dog doesn't trip me. But it makes walking a whole lot easier and moving around much better for me.
Pets are very good reminders that it's time to get going. Yeah, that's awesome. Thank you guys for sharing. So on the next slide, I have just like a couple of recommendations on how to keep motivated. And you guys have already said a lot of this. So social support, having somebody else to help keep you accountable, like a group class or a pet, that's going to make it easier to be consistent. Keep it fun. So there's a lot of ways to exercise. You don't have to be in a gym. You don't have to be in a pool. You can be active in so many different ways. So if you're not enjoying yourself, maybe try a different type of exercise or put on some music just to help you kind of focus on the positive. Keeping track. So having a journal or a calendar can be very helpful to visibly see what you have accomplished. It can also help us stay accountable because sometimes the days get lost a little bit when you have a lot of appointments or things going on. It can be hard to be accountable to actually exercising consistently. Make it easy for yourself. So set up your supplies in advance. For example, have your clothes for your gym workout or for your home workout. Have your chair cleared of clutter. Make it easy for yourself. Have it scheduled at a time where you're going to be more likely to do it. So for example, if you tend to have doctor appointments in the afternoon, maybe a 5 p.m. workout isn't the best thing for you because you come home and you're tired. Maybe doing a morning workout is going to be best. So try to make it easy for yourself. And then lastly, try to just be patient with yourself as you're developing a routine. Stay persistent and know that it'll be worth it in the long run. Not every workout has to be fun. Not every workout has to be like, wow, mind blowing. I feel so much better. Sometimes it's just about consistency and showing up for your body, and you'll feel better in the long run. So Leslie, if we could just kind of go around, like, what is your biggest motivator to being active? What is your biggest motivator to exercise? Folks can share what keeps them going.
Well, I'd like to remind people of the yoga balance class that the village offers. I've been taking it for a number of years, and it's probably my main source of exercise, and it has really been helpful. I've just been through a major surgery, and I think I would have been in a lot worse shape if I hadn't been doing that. But that's Monday. It's Monday morning and Thursday morning at 8 o'clock, and it's virtual. And there's a link on the website.
That's awesome, Laura. Thanks for sharing about the class. You guys have so many exercise classes so frequently. That's really cool. All right, so then last slide is just a couple of resources. This first one is a link to an activity diary. So if this would help you to kind of get an idea of where you're at in terms of how active you are and how much exercise you do, you could use this. And then the second one is a handout. This is a worksheet that kind of goes along the lines of like motivation and goal setting and kind of tips to get started. So that's the kind of a tool for you if you like. And just this is my encouragement. Let's like keep moving. Let's get moving. So yeah, thank you guys for being here today. What questions or conversations or anything that you'd like to talk about as we wrap up our time?
Well, one of the things I'd like to bring up, and I know I'm not alone, the sidewalks in Hyde Park.
Mm-hmm.
My husband, who, as I said, is 95, and had physical therapy for a hip. And the physical therapist kept wanting him to stand up straight, to keep his head up. And he said to them, have you walked on the sidewalks of Hyde Park lately? You need to bend, your head, because there are so many barriers and cracks. 2 years ago, he had a major fall on the underpass on 53rd Street because there was a pile of concrete left over from when they did the sidewalk. Now, he walks that frequently. He knew it was there, but he was in a hurry, missed it, and had a major fall. But I think so the more, and as the village tries to enable Hyde Park to be dementia friendly, one of those things is to enable because people do walk in Hyde Park. And so to have our sidewalks be more accessible and be safer for folks.
Yeah, I think you bring up good point about safety. So as we age, we need to be more attentive to our environment. When we're younger, we tend to use our peripheral vision and we have faster reaction times. We can navigate those challenges a little bit easier, but as we age, we have to be more attentive. So your husband is right that he does need to look at the surface ahead of him and prepare for
Right.
those balance challenges. So oftentimes what I recommend of patients is that you can think about walking in two different ways. You can think about walking to get somewhere, and you can think about walking for exercise. So if you're in an environment where you're not able to walk at a good clip with good posture for an extended period of time, then maybe we need to change our location. So for example, walking on a track at one of like the schools could be an
Mhm.
option, or the Museum of Science and Industry, where you can get your nice consistent speed with your nice posture that doesn't hurt your back, and you can use that more so for your exercise for walking versus you're walking to get somewhere. And that's kind of going back to that concept of physically active versus exercise, and both are good.
So walk to go to the.
And I love that
On the other hand, go
advocacy.
ahead, Susan.
I love that you guys are doing that advocacy to make it safer. And I think even beyond the sidewalks, I still have other concerns of bikers, people on scooters, loose.
Oh, bikers. Yes.
Absolutely. That's a major gripe of mine. People barreling down the sidewalk on a bicycle.
Or those e-scooters that go like 20 miles an hour. Yeah,
Yes.
yeah.
I'm a
Or-
cranky old lady and I yell at them.
I do too. People who can't walk one at a time to share the sidewalk, the friends, you know, it's like they're joined somehow and they have to take up the whole sidewalk and I'm supposed to step off, you know.
Yeah, some people are just like in their own little world.
And
Mary,
you know,
Mary, were you trying to say something? You're on mute still.
Well, people have
I
their
went-
phones on, so they don't even see or hear other people around.
Yeah.
I was going to say that here I'm walking, I have a walker, I have a dog that is trained to walk with the walker. And there, as what she was saying about the sidewalks in Hyde Park, around where I live, a lot of them are uneven. So maybe 4 big squares will be even and the rest will be anything. And they're cracked a lot. The other thing is what she had mentioned about the bikers coming through. There have been times that I've walked with the dog, I'm keeping her to one side, but there's another person walking straight at me because there's somebody coming down with a bike or one of the Zoom things. And it's impossible sometimes to try to figure out. Bikes are supposed to be in the street, supposedly, but they haven't. Some people haven't learned that yet. I don't know.
they need to be encouraged to learn.
Well,
Yeah,
I have
but
found,
also-
I have found when I'm walking with the cane, people are much more likely to give way.
Hmm.
Yes.
They see you with the cane and they go around a lot of times.
Years
Of course,
ago,
you have to be careful walking across the street. My complaint, of course, mostly when I'm driving is that the bikes who don't even pause at the stop signs.
No, they don't.
And they go the wrong way down the one-way streets.
Yeah.
But the issue between walking to get somewhere and walking for exercise, I mean, my husband walks to an office that's a few blocks away. And while I would prefer to have him at home, well, I'd prefer to wrap him in bubble wrap, but can't do that. So, but we want to get older folks out and now not in the wintertime, of course, and not in superheat. But so I think it's to our advantage to pressure the city and Hyde Park to have better sidewalks so older people can feel safe in walking on our sidewalks and get out and walk to the store, walk to the drugstore, to get that amount of exercise at least.
Mhm. Yeah, definitely.
I would think it would be great if the city of Chicago, even though they are pushing for bike lanes and more bikers, because it's good for everybody, and they should at least have a little more education for people riding bikes because a lot of them don't use the bike lanes. They're on the sidewalk. And I once asked a person who almost ran into me, why are you on the sidewalk? You have a bike lane. And the person said, yeah, but I don't feel safe in the bike lane. So
Yeah.
So I don't
Don't
feel
ride your
you on
bike.
the sidewalk.
Yeah, it's such a trickle down because of how I think, not to go on a whole spiel about it, but I feel like it all trickles down from our culture's sense of urgency that we have to get somewhere
Mhm,
fast.
mhm,
That we are the priority.
mhm.
It trickles down to bikers not feeling safe, to walkers not feeling safe, and it's just, we need to change our culture.
yeah, we do.
Yeah.
Not just the city of Chicago, it's private companies too. I had a major fall years ago over a poorly joined sidewalk between CVS and whatever Pizza Capri used to be there. It's a little thing, and my shoe caught on it, and I went down flat and slid on my face for a little
Mm.
while. That's not the way to go to CVS, by the way. And I ended up one of my contact lenses popped out of my eye. That's how serious the fall was. And apparently I passed out. I broke a wrist, and I passed out because the lady said, you were just lying there in a pool of blood, not moving. I didn't know what to do. She was like,
Mm.
clean it
Mm.
out. But it was that. And I talked to, people were pushing me to talk to a lawyer. The lawyer said, go over there and measure that bad joint, and it has to be a quarter. I think it was a quarter, 25 cents a piece or larger, in order to sue.
Hmm.
That's what he said. But I went back over there after the ER and took pictures of the blood on the sidewalk. So I thought, oh,
Hmm.
fine. I mean,
Happened.
I could walk then, and I was rushing, but that changed things.
Yeah. Well, thank you guys again for coming out today. I've got to get going on to my afternoon patients, but it was so wonderful to talk with you all. Thank you for sharing your experiences of trying to stay active and exercise and finding community in that. It's really great to hear.
Thank you.
Thank you. Very informative.
Much.
Thanks for all the suggestions.
Thank you.
Absolutely.